because we don't know much about what psychosis is. When people start behaving in that way, it's quite awkward and weird, See someone say, I can see something pass here, and then, describe it, and then we can't see it together with a person. And then pussy, I can hear someone talking to me, and we all cannot hear it. And it's, you see that the person is suffering in their heart is in that state. Part of it as Africans, you attribute to the spiritualities. Of course, there's spiritualities. Spirituality.
Hello, you're welcome to this program. And today we are about to talk about one of the most interesting topics in psychology. And I know that you've heard about it, and that is psychosis. And this program is going to expose us to what psychosis is, what causes it, or what intervention can we give to such individuals suffering from such mental illness. And before then, if you've not yet subscribed, please subscribe, like, and share our video. Joining us today is a lecturer in the University of Peoples, as well as a clinical psychologist and a neuropsychologist in the Department of Education and Psychology. In the person, Dr. Daniel Miezah. Doc, you're welcome to this program.
Thank you so much. Thank you for having me.
Wow. Doc, please, we know there are a lot of prevalent issues out there as far as clinical psychology is of concern, or mental health is of concern, with the issue of psychosis.
Right.
Most of the time, people think to see things that are not in existence as far as their fellow colleagues are around them. They tend to hear sounds that only them can actually, define and explain, while their other colleagues can also hear them. A lot of delusions and disorganized thoughts that characterize these psychotic individuals. But in this program, there are a lot of misconceptions, and I believe that you being a practitioner in clinical psychologist, you uncover the truth behind psychosis. So we want to understand first, what actually is psychosis? When we talk about psychosis, what is it all about?
Right. So psychosis, before I even talk about what it is really on the side, like, it's quite prevalent in this time. When we say psychosis, we are talking about a clinical condition, and then we are talking about the fact that someone has lost their sense of touch, reality.
Okay.
The way we all see reality, this person is not seeing it like that anymore. So the person can be here and tell that I see someone walking here. I can hear someone talking. When all of us here cannot be there through what the person is saying, we are not seeing what they're saying. So not stagnant that the person is actually out of touch with reality. They can come in hallucinations, they can have issues. In hallucinations, they hear voices, but as we are here, they can hear someone hit them, or we will not hear it. They can see someone passing by, who don't see anybody. They can have a false belief that somebody already killed them, and that we know you can't raise as ashamed not to be in reality. So basically, they've lost their sense of touch in reality.
Wow. So, okay. Giving us a brief concept of what psychosis is here, and what actually is the cause, because all of a sudden someone just seeing things that is peculiar to them, while others cannot see, hearing voices and disorganized thoughts, and many other things that is associated with this problem. So what really causes the psychosis? Is it more of a medical induced problem, or there are other psychological factors that you can throw light on for us to get an understanding of this?
Yeah. So there are so many factors, that can lead to psychosis.
Okay.
One of them being trauma. Part of a childhood traumatic experience that could have had. They were traumatized, they are being beaten, they were in abuse, they went through that trauma because of time before they grew up. This trauma that they've not done is something that can lead them into psychosis in later life. Trauma is one of the big things that can actually lead people into psychosis. So, for people like that, if the root cause of their psychosis is trauma, childhood trauma, then it's all about dealing with that trauma, and then help them to deal with the trauma. The psychosis starts reducing, starts going away, because the trauma, which is the cause, the psychosis are later. So that is the best one about it.
Psychosis, right? Okay. So though, aside the trauma, are there any other factors that could, contribute to an individual, or let me say to, let's say contributes to in terms of such illness, because there are times that has been associated that, sometimes when someone drinks or someone is depressed, when someone is in a bad state, of the self, they tend to, drink alcohol and other stuffs. Yes. Can we say alcohol drinking can be one of the major causes to why people become psychotic?
Right. So all the fact that you've read about alcohol and all of that, at least somewhere in psychosis, I'll take it one out there. Even before we go into that, the point that we raised about trauma, one of the reasons why trauma are naturally linked to psychosis is the fact that the effect of trauma on people, one of them is the effect on the brain. Wow. So when the black are going through psychosis, it's a question of the brain. The brain is our brain that triggers them. Where they see a reality that nobody sees, the brain that is messing up, right? So we can say that trauma has an effect on their brain, and that is why they get those bad messages, and they are seeing things that nobody sees. So that is the point for trauma. Now, you talk about alcohol, which having alcohol in this hypothesis. So taking alcohol for longer periods of time and definitely impair the brain. Whenever the brain is impaired, we are actually developing psychosis, right? Also, those who like alcohol, now they take lifetime taking of alcohol, excessive alcohol DJ, would on the long run impair the brain. And when the brain is some way, create psychosis. That is for alcohol. Okay. We talk about stress, right? We have so much stress in also there is a stress, its impact on the human body, one of the biggest impact because of the brain. Stress also got it there, the brain. Likewise, depression that people are going through, right? Or likewise, smoking of cigarettes. When people smoke excessively, it can also impair the brain. So for this part of depression, anxiety, and other points that we mention, alcohol, all these things can impair the brain. When they impair the brain, why doctor will see psychosis? Okay, you get a point here, right?
So, Doc, you spoke about stress, and there's something that is very interesting, as we know that stress is one of the major things, people go through, right? Especially as students, as being a clinical psychologist, student goes through a lot of academic stress and even sometimes financial stress. But then, Doc, how would an individual in a position of being stressed, right? Okay, how are you going to help an individual, come out with a coping strategy that will mediate or intervene and prevent him or her from being predisposed or, developing psychotic disorder? Or what are some of the interventions that as students or individuals going through stress, adopt,
right,
that can mitigate the problem of psychosis?
right? So there are so many strategies for dealing with stress. Of course, if stress is the fundamental process, psychosis, dealing with it will mean that psychosis has spawned up. Okay. So if we are talking about dealing with stress in order to ensure that stress goes down, psychosis go down, such a client or person, then we are talking about all the factors, or now we know when it comes to deal with stress. Making sure that you are sleeping, between 8 to 7 hours at night. Sleeping is a healer for the body. And the more sleep people can get between 7 to 8 hours a night, the better they're able to deal with stress. Right? Yeah. That is just one way of dealing with stress. What about exercise? We know that exercise releases some chemicals in the body, and those chemicals help to stop the stress response into a relaxation response. Therefore, exercise has been proven to be one of the main factors that can help get with their stress. How about changing the meeting course? That the both, but the thought that they cannot make money, the thought that they cannot be successful in the snack, the thought that they are able to die. All these negative thoughts are also temporarily to stress. If they can identify this negative thoughts and then deal with them, stress should start going down. How about after balance time? Oh, so many factors for dealing with stress. How about meditation? How about liquor drinks? As well as so much.
Wow. So basically mean that, our lifestyle can contribute to, it's one of the major contributor to psychosis.
Of course, yeah, the things we have to do and the things that we don't have to. We've measures about the things that we can do which will help us deal with stress. So if we are doing those things that stress is done, but we are this not responsible of a psychosis. Okay, but we don't do that. We don't exercise. We don't sleep properly at tight and so on and so forth. We are increasing our risk for stress. When the risk of stress is higher, you also increase our risk for psychosis because stress will impact the brain. When the brain is impacted, psychosis is possible.
Wow. So, Doc, I'd want to find out, most people turn out to be predisposed to psychosis. It just as you mentioned, the environmental factor, then stress, academic, finances, and all other factors contributing to psychosis. Are there times that an individual, having his environmental factors being checked or being, get at normalcy, but still the person could be predisposed to a psychotic? That is talking about the biological factors. There no link between psychosis and genetics or biology.
Of course, energy predisposition of the psychosis is there. Some players genetically predisposed to it. Some before our biological imbalances in their neurochemistry, and that can also lead to a psychosis for sure. So of course they understand that there are some the predisposition, neurochemical imbalances in the body can lead to psychosis. In that sense, part of the medication becomes, attend to, that we see psychiatrists, they can give some medication, but through those kind of imbalances, they help biologically to be able to deal with it a bit. But of course, you still do not hand because part of it, even if the blood that can be exposed, all this issue that we would mention, alcoholism, smoking, stress, depression, anxiety, right? Traumatic experiences. These things are in our life all the time. So even if we are using medication to deal with, you still need to work on these things in the person's life to ensure that we can deal with psychosis.
Okay. So, Doc, there are a lot of misconceptions about psychosis, right, out there, right? A lot of misconception. There are people saying individuals with psychosis tends to have a different frame of language for them. So can you tell us what misconceptions are there about psychosis?
Right. I mean, as Africans, we have a lot of perceptions about this because we don't know much about what psychosis is. When people start behaving in that way, it's quite awkward and weird, See someone say, I can see something pass here, and then, describe it, and then we can't see it together with a person. And then pussy, I can hear someone talking to me, and we all cannot hear it. And it's, you see that the person is suffering and their heart is in that state. Part of it as Africans, you attribute to the spiritualities. Of course, no spiritualities. The spirituality was who did the spirituality, of course, will tell you that things back and lead to some of this. It's just true. I mean, from your point of view there. But like you are saying, this conception of some people will take as a spiritual case. But there are times that it's not really a spiritual case. There is something that has happened that basic a clinical condition that someone can become psychotic, and see things, but nobody can see it. I tell you that they hear that doctor I can get. It's a clinical condition. Of course, we can have the spiritual expectations, which are where that from that point also. But, we have the clinical condition, psychosis, and we thought that in manners, so we get ways up.
Wow. So though, an individual suffering from psychosis, what is the first point of contact that families can do to, intervene? So let me say, both families and then the clinical health, settings they can do to intervene or manage or treat.
Families in the rest of all, the best place is the hospital. They need to send the person to see professionals, clinical psychologists, psychiatrists. Quite often, both of these guys who work together to help the person to overcome the psychosis. Psychiatrists will come in if it's necessary or the psychosis at the level that requires triggers. And then sometimes you don't require any issue at all. Clinical psychologists will come with her. Sometimes you would just need medication to calm the person now. And the therapy, you told us sometimes you get outpatient therapy and medication, sometimes you get therapy, sometimes you get a medication. Okay, So going to the hospital and seeing these aspects will help the person to be helped using professional ways to help the person for sure.
Wow. So can you tell us your last words for viewers out there Yeah, but it's as a caution for us, as far as you've mentioned stress, trauma, and other things that can be, triggers of psychosis. I believe that your word of caution for us can be a very instrumental knowledge in our lives.
Right. So my last words, looking at as I said, we have alcohol induced psychosis. Psychosis that occurred as a result of excessive alcohol intake or lifetime alcohol intake. Smoking induced psychosis, the psychosis that occurred because people are smoking cigarettes or other substances for a lifetime excessively. These are things that are prevented, So changing those kind of plans as being that we can prevent some things in our lives. Now we will not take them to the point alcoholics. Look, to the point that we our brain and therefore make us pick up psychotic. You get the point I'm making. Right. So we have our own destiny in our own hands. Wow. Change the behavior to by psychics.
Wow. So you change the behavior, you prevent psychosis. Thank you for joining us for this program.